Hello everyone. For this video, we will talk about tips and management of patients with COVID virus infection at home. Nowadays, if possible, home is the safest place to stay when you are sick. Lesser chance of being infected by others and more diseases. But first, welcome to my channel. My name is Jordia. I am a Filipino-American registered nurse, OFW, a traveler, and founder of Care to Heal. This video is brought to you by Care to Heal. Please support my channel. Please like and subscribe. Many healthcare facility or hospitals do not admit stable patients with COVID infection. In fact, many physicians do not prescribe antibiotics. As many of us know, COVID is virus. Virus cannot be treated by antibiotics and can be only dealt with supportive care measures. Before we talk about the supportive care measures, let's talk and understand this virus first. COVID-19 virus is a disease of the respiratory system. It is highly contagious and can be transmitted via airborne and direct contact. It means that the virus can spread the infection through the air, and by touching the virus from any contaminated surfaces and accidentally inhaling it. The potential serious effects are difficulty of breathing, bronchitis and lung infiltrates such as pneumonia, and at times, blood clots. One of the most common complications of COVID virus and any respiratory infections is bronchitis. Bronchitis is a respiratory condition characterized by inflammation of the bronchial tubes, which are the air passages that carry air to and from the lungs. This inflammation can result in a persistent cough, often with mucus, sputum production. Bronchitis can be acute or chronic. Acute bronchitis typically caused by a viral infection, such as the common cold or flu virus. Bacterial infections can also cause acute bronchitis but are less common. Symptoms include cough, often producing clear, white, yellow, or green mucus, chest discomfort or tightness, low-grade fever, fatigue, and sometimes wheezing. Duration: acute bronchitis usually lasts for a few days to a few weeks, with the cough sometimes lingering for several weeks after the infection has resolved. Treatment often resolves on its own without specific treatment. Rest, hydration, and over-the-counter medications to relieve symptoms, such as cough suppressants or pain relievers, may be recommended. Antibiotics are not typically prescribed unless there is a bacterial infection present. Chronic bronchitis often a result of long-term exposure to irritants such as cigarette smoke, air pollution, or dust. It is a type of chronic obstructive pulmonary disease, COPD. Symptoms: similar to acute bronchitis but persist for at least 3 months out of the year for 2 consecutive years. Chronic bronchitis is characterized by a productive cough that lasts for a long time and often accompanied by shortness of breath and wheezing. Complications: chronic bronchitis can lead to serious complications, such as respiratory infections, pulmonary hypertension, and respiratory failure. Treatment management focuses on relieving symptoms and slowing the progression of the disease. This includes quitting smoking, avoiding lung irritants, and using bronchodilators or other medications to help open the airways and reduce inflammation. Bronchitis is a common condition that can affect people of all ages. While acute bronchitis often resolves on its own with rest and home care, chronic bronchitis requires ongoing management and lifestyle changes to prevent complications and improve quality of life. If you suspect you have bronchitis, especially if you have a fever, persistent cough, or difficulty breathing, it's important to see a healthcare provider for an accurate diagnosis and appropriate treatment. For any individual who got exposed to the virus, it is vital to know and recognize the symptoms to avoid infecting more people. How to recognize the common symptoms and identifying signs of infection. What happens after you get infected? Feeling unwell, mostly will show negative test result. Muscle and joint pain. Tired and feeling weak. Fever and chills, very common signs and normally will show positive test result at this point. Headache. Sneezing or coughing. Colds and congestion. Change in voice, hoarse voice. Diarrhea. Shortness of breath, if left untreated. How to manage mild COVID-19 at home. The symptoms and the self-care. Many COVID cases are being managed at home. Healthcare providers prefer safety of patients by discharging stable patients in their own homes instead of being exposed to more diseases in the clinical facility. Remember, when someone is sick, their immune system to fight more infection goes down too. When a decision was made that home treatment is appropriate, addressing common symptoms with home remedies and over-the-counter drugs called supportive measures with rest, hydration, and nourishment are essentials. However, monitoring the illness and knowing when to seek medical attention is a must. What are the supportive measure medications and home treatments? How we can ensure safe usage. There are approved medications for treating mild COVID-19 at home such as Paxlovid oral pills. It will reduce the severity of the symptoms but can prolong the duration of the infection. Below are home-based effective treatments, but be mindful that everyone needs to understand the limitations and risks of self-medication. Fever and headache, antipyrexia and analgesic medications such as acetaminophen or ibuprofen, Tylenol or Advil. Vitamin supplements B12, zinc, calcium and D3. These supplements can boost your immune system to fight the virus. Warm steaming and inhalation can help to loosen phlegm, prevent dryness and irritation of nostrils, and dilate breathing passages, bronchi. Decongestant and expectorant, over-the-counter medications such as Robitussin DM, Mucinex, and Equate-Tussin DM can expedite loosening your phlegm. Back tapping, additional treatment method to loosen phlegm. Proper ventilation, open windows to circulate fresh air. Remember that you are preventing pneumonia and blood clots formation. Protective measures and cleanliness, reducing transmission risks. As you fight the virus, the sanitation and disinfection of your home is another important factor. The correct use of personal protective equipment, PPE, https://amazon.de/3 such masks and gloves are emphasized. Hand washing is a universal and primary sanitation practices that helps to lower the risk of spreading the virus at home. Alcohol gel is another option but can't replace the hand washing benefits. Your family must unite and be a unit in creating a safe environment for the uninfected. Develop isolation strategies like designate a bedroom with bathroom for the infected person. Leave the food tray outside the bedroom door and text the patient. When and how to end home isolation and return to normal activities. For infected people without symptoms, 5 days isolation is needed. For patients with symptoms, 10 days isolation are highly recommended. After completion of these isolation days, sanitize your entire house by spraying each rooms, mopping floors, and wiping surfaces with disinfectants. Wash all linens, curtains, and rugs. I hope you enjoyed this blog. I highly appreciate your time and comments. Kindly leave a short comment. Every comment will help me improve the content of my blogs and articles. For faster delivery and medications need, please visit caretoheal.org. Thank you and see you in my next blog. Please click like and subscribe below.